The surgery of doing breast augmentation is you want the patient to have a very good long-term result, and it's all about gravity and aging. So the bigger the implant, the heavier the implant. The poor breast, if it's holding up this big heavy implant, if it's something that's as big as this relative to something that's as small as this, you can imagine that the bigger, heavier implant will put a lot more pressure and strain on the lower part of the breast. So just by placing a bigger implant, it might look big and fantastic for the first 6 months to a year. But as that implant drops, it stretches the skin. And I just think the long-term results of a big, massive implant are not really ideal. And also, if you put an implant in a young patient and you don't respect their anatomy, the implant won't sit in the correct position. And then if things do go wrong in those type of patients, revision surgery can be a lot more complex, a lot more difficult. So you don't want to overstretch the skin in the primary surgery especially. You want to respect the anatomy and keeping in mind as well that you're going to be replacing your implants every 10 years at least, because the implants are warranted for 10 years against rupture. So if you are going to commit at a young age to putting a big implant, understand that in 10-15 years time, after your first procedure, you're going to have another one. So the bigger you go in the beginning, the more likely you are that you might need a lift or a much more complex revision. So I always advise my younger patients, smaller is better, especially if you're going for the first time, because I really believe that you'll have a much better long-term result.